Hi everyone, I am Ananda Raj. The seventh unit is mental health and mental hygiene. And in this, two concepts are there. One is the mental health and mental hygiene. And in this, you know the definition of the health which is given by WHO. Now let's see the definition for mental hygiene. Mental hygiene is the ability to withstand the stress. Number two is the mental health. The definition or the meaning for the mental health is it is positive but relative quality of life. These two are the concepts, and here based on this mental health there is a classification and explanation. The first one is the characteristics of mentally healthy individual. There are certain characteristics are listed, around 20 characteristics are there. I briefly tell them, then you have to describe and explain them. Number one is a mentally healthy person is a well-adjusted person. Number two, his self-esteem and confidence is high. Number three, the person understands the responsibilities. Number four, he attacks the problems that require solutions. Number five, he can use thinking before the action. Number six, he learns from the defeats. Number seven, he can say no to the situations which are harmful to him. Number eight, he can show the anger directly. Number nine, as he is mentally healthy, he expresses emotions in a desirable and controlled manner. Number 10 has the capacity to socially adjust with others. Number 11 is the intellectual powers are well developed. Number 12, he lives in the world of reality. Number 13, he has the courage to face the failures. Number 14, he conforms or confined to the norms of the group. And number 15, he sort out the problems appropriately and does not suffer from any anxiety, frustration or conflict. Number 16, he is always punctual for his duties. Number 17, he is self-confident and optimistic. And number 18, he has adequate sex adjustment. Number 19, he is well adjusted and happy with others in his profession. Number 20, he leads a balanced life of work, rest and recreation. And the foundations of the mental health, the basic factors are: number 1, heredity; number 2, physical factors; number 3, social factors like home, school and community; number 4, satisfaction of the basic needs of the child. So these 4 factors which play an important role. And the next topic is the warning signs of the poor mental health. There are certain warning signs are observed in a person with a mental health disorder, and their adjustment mechanisms are there. If they are overused or if the person cannot adjust with himself, then the disorders may be observed. Number 1 is the physical symptoms. Number 2 is sensorial symptoms. Number 3 is general clouding of consciousness. Number 4, disorders of perception. Number 5, symptoms in the area of ideation. Number 6, loss of higher level of control. Number 7, speech disturbances. Number 8, symptoms which are connected with the disorders of the affect. Number 9, disturbances in the sleep. Number 10, depersonalization. These are the 10 important points which has to be explained in detail. The general causes of the mental illness is the next topic. One is the heredity. Number 2 is organic causes like loss of brain tissue due to injury or damage to the brain tissue by the toxic drugs. Then interference of the brain tissue with other blood chemistry changes. Next is endocrine disturbances. The third one is the vitamin deficiency. Vitamin B complex deficiency may also lead to the problems. Number 4 is the fatigue. Number 6, surgical operations like trauma. Number 7, pregnancy. Number 8 one is the epochal crisis. It's in the time of puberty or adolescence or at the menopause. So these are the basic factors which lead to some psychological problems, and the third one is psychological or psychogenic factors also may lead to the problem, and socio-cultural, socio-economic problems also may lead to the certain mental disorders. And these mental disorders are classified into different types, and there is a promotive and preventive mental health strategies for promoting the mental health to make the people get the awareness of the mental health. And there is a health for all by AD 2005. There was all the countries which have the representatives of 134 nations have joined together in 1978, and they have decided that there should be health for all by 2025, and people are working on that to reduce the psychological problems. And the nurse has a basic role in doing the guidance and counseling. And what is the guidance and counseling is a separate topic, and counseling is a helping service. Here the essential nature of counseling consists of helping the individuals to help themselves. Is the basic concept of the counseling, and counseling is a part of guidance, and the counselor who is doing the counseling has got certain characteristics. So the characteristics of counselor: number 1, emotionally stable; number 2, respectful of facts; number 3, sensitive to others; number 4, his objective help all. His objective is to help all, not one person. Number 5, lot of patience. Number 6, trusted by others. Number 7 is understanding. Number 8 is friendly. Number 9, sincerity. Number 10, social intelligence. Number 11, pleasantness. Number 12, kindliness. Number 13, fairness. Number 14 is the tolerance. Number 15 is the stability. Number 16 is the neatness. Number 17 is the calmness. Number 18 is sympathetic attitude. Number 19, sense of humor. Number 20 is broad-mindedness. These are the basic characteristics a counselor must have. And the guidance is a systematic professional process helping the individual through educative and interpretive processes to gain better understanding of the potentialities to adjust with the environment. So guidance has got the major part of is called as the guidance, and counseling is a part of the guidance. So these two are the one which are important, and the nurse has to do the counseling to the patients whom she is getting. And there are different ego defense mechanisms. Next topic is the defense mechanisms or the ego defense mechanisms. In the coping method or coping of the stress, person has got different methods. First one is the direct coping, and the second one is the defensive coping. In the direct coping, there are three things are there. One is confrontation, second one is the withdrawal, third one is the defensive coping. So three things which are important in direct coping is: number one, confrontation; number two is compromise; number three is withdrawal. So these three are the one in direct coping. The second one is the defensive coping. In the defensive coping, there are certain methods. There are two methods. One is the successful coping, and the second one is the unsuccessful coping. In successful coping, again, many types are there. They are: number one is repression. I tell them briefly, but you have to explain in detail. Repression is unconsciously forgetting the unpleasant experiences. Number two is a rationalization. Rationalization is making excuses, giving reasons. Number three is intellectualization, distancing oneself from the emotional situations. Number four is compensation, working hard to make up the weakness. Number five is substitution, substitute with other things. Then the sublimation. Sublimation is directly unaccepting the desires, or directing the unacceptable desires into an acceptable ones. Then unsuccessful methods. Unsuccessful methods, again, the many types are there. First one is the suppression. Suppression is intentionally pushing away from the unaware or from the unfavorable conditions or unfavorable thinking. Then the next thing is, second one is reaction formation, strongly expressing the reverse what person feels inside. Then the third one is the displacement, discharging the pent up feelings. And the fourth one is denial, refusing to believe that something unpleasant is existing. And the next one is the isolation, keeping oneself separated. And the next one, projection, is pretending that others also have got same failure, or others also have got same failures like him. Then regression, acting immaturely. And conversion, emotional conflict is expressed by physical illness. Next, fixation, fixing to one idea. Next is the fantasy, withdrawal to make believe world, or when they are facing real problems, they withdraw themselves from the real things. These are the defense mechanisms which are used by every person, and each point is important, and this one has to be explained in detail. So in the coping of stress, these major points are important. The question may be asked, how to cope the stress, or what are the ego defense mechanisms, or they may ask separately that explain the defense mechanisms. So these